Namaste all the viewers and friends. We have again come up with a new video, new topic for discussion today. And before starting the discussion, we would want to thank you for the response that you have been giving us for the videos that we are making. We wish and hope that you continue subscribing, you continue watching our videos and also commenting, suggesting the topics that you want us to cover for you. So today the topic that we have come up with is antenatal care, or the care that is provided during pregnancy for the 9 months. It's also termed prenatal care in certain places. So why is it important? The 9 months of pregnancy ends with giving birth to a new life, which is as a joyous experience, of course, but also is a very responsible process in itself. Every change that she goes through during pregnancy will impact the growth and development of the fetus, and of course it will impact the birthing process. It will impact the growth and development of the baby after birth. So antenatal care in reality begins before she even gets pregnant, but for these 9 months it is very, very important. What is the goal of antenatal care? The 9 months that she is pregnant, it should be comfortable for her. She should be in her optimal physical and mental health, and the end of the antenatal period, which is the delivery process, should be comfortable, should be as natural and normal as possible. So this is the goal of antenatal care. So what comprises of antenatal care? It involves the food that she takes, it involves the environment that she resides in, it involves the physical activity that she goes through during these 9 months, and the therapies, natural healing therapies and solutions that she will go through during the period of pregnancy. Why is it important? Like we discussed, every emotion that she experiences during her pregnancy, every change that she goes through in terms of her body, in terms of her hormones, in terms of her physiology, everything, every individual thing will impact the fetus. So what symptoms are there during these 9 months, that is the 3 trimesters? There's nausea, there's vomiting, there is a little bit of fatigue, there's change in the frequency of urination, there is for some people acidity or GERD-like symptoms. There's for some people also, some women also go through constipation. There's issues with sleep. Sleeping issues can be there. Some people find it difficult to fall asleep, maintain their quality of sleep. There is also lot of confusions, lot of questions in her mind because she's not aware of what she should expect out of the whole process, what uncertainties she might face, she might not face. So there are so many questions that she'll have, concerns that she'll have. So a care involves first talking to her, giving her space to give her space to ask her questions, to discuss with her concerns and queries, to give her answers that she is looking out for. So counseling is an important aspect of antenatal care. Counseling involves the balance of the medical information and also the ancestral experiences, and everything put together will give her strength. Food, what she eats will shape her and the fetus within. So a balanced, holistic, nutritious food is very, very important. So if she is given the input on what she should eat, how she should eat it, and what is the mindset with which she should eat it, what she should avoid during pregnancy in terms of food is very, very important. So that is one aspect of the antenatal care. The second aspect, the physical activity. She being physically active is very, very important. Balance between the amount of rest she takes and the activity that she does is very crucial to the development of the space within for the fetus to grow, and also it eases her symptoms. For example, if somebody is not physically active at all, if they're always sleeping, if they're always sitting and working, not really moving around, they can end up having a lot of GI symptoms like constipation, back pain, lower back pain, GERD like symptoms, that is acidity and regurgitation. So all of this will reduce the quality of life during pregnancy. So physical activity is very, very important. Yoga is one of the the most recommended physical activity that a pregnant woman can go through, because it will not only work on a physique but also on the mind. It will calm her mind down, relax her mind, and ease all the anxiousness, ease all the discomfort that she'll have. So yoga therapy is one of the physical activity. Walking is another thing that will help her during pregnancy. Along with this, the therapies that we discussed. First one, the acupuncture. Acupuncture is very much recommended during pregnancy. It's not a contraindication and absolutely safe. It is very much safe to go through acupuncture. Acupuncture as a traditional Chinese medicine can take care of lot of symptoms. It can aid the nourishment of the mother and the fetus, and also it can help in the relaxation of the mind. So there are points that will ease nausea, there are points that will ease constipation, there are points that will help improve the metabolism and extract better nourishment out of the food that she takes. There is a point that will help in very good development, growth and development of the fetus. So acupuncture helps in a great deal working on her body and also relaxes the mind. Just the process itself, procedure of acupuncture itself is very, very relaxing while she's taking the treatment, and also the effect that it leaves behind is also very, very comfortable for the woman to go through. Along with this, like we discussed, counseling to give her space, to give her time to talk, to ease her mind with asking her questions, discussing about the concerns that she will have, and also giving her strength and support that there are people with you, there are all the facilities with you to take care of your 9 months, take care of your pregnancy. With pregnancy is mark of her strength and patience, and if she has to be strong and patient, she will definitely require the support system, and antenatal care is all about that support system. So it is during pregnancy, it aids the comfortable pregnancy, and also it aids the very comfortable and natural normal delivery, the process of delivery. So with practice of yoga, with good nutrition, with good therapies like acupuncture and counseling, we can comfortably expect a normal delivery for women. She need not have to go through complications. Optimum care not only makes her comfortable, will prevent lot of complications, and can take care of high risk pregnancies like increased blood pressure, increased blood sugar, and all of those high risk complications in pregnancy can also be prevented and very effectively managed with these therapies and practices. So if you're looking for antenatal care, please visit Anandamaya Wellness Center, and we'll be very glad to help you make your journey of pregnancy a comfortable one. Thank you very much.